Yes.
Hello, how are you?
Hey, how are you?
Good. I'm Ricketta Clark. I'm the nurse practitioner
Okay.
that's going to be doing your examination today. Your name?
Travis.
Travis, nice to meet you. What I'm going to be doing today, Travis, is just doing briefly a lungs and thorax examination, along with a peripheral vascular examination. And lastly, I'll be doing a cardiovascular examination. Is that okay with you?
That's fine.
Wonderful. This exam is going to involve some light touching. So I'll be touching your chest, I'll be touching your legs, what have you. Is that okay with you as well?
Yes.
Okay, wonderful. All right. In assessing your lungs, I'm going to first take your respiratory rate. Okay, is that okay with you?
That's fine.
All right. So I'm just going to be just looking, and I'm going to assess that respiratory rate. Okay, the patient's respiratory rate is 12 breaths per minute. His respirations were regular. He had minimal effort in breathing. I didn't see any use of accessory muscles or any contractions of his neck muscles while breathing. I'm going to look at your skin next, Travis, okay? His skin color is appropriate for ethnicity. And I'm going to now kind of look at your chest. If you don't mind, I need to see your chest. Undo your gown if that's okay.
Okay.
Okay, wonderful. Just pull this down if that's okay. If you could go ahead and just pull it down for me. Okay, I'm looking at the skin color of his chest. The skin color is appropriate for ethnicity, anteriorly and posteriorly. I don't see any evidence of cyanosis. The shape and configuration of the chest is smooth. The contour is without any barreling of the chest noted anteriorly or posteriorly. There's no retractions noted while he's breathing. Again, his breathing movements are smooth, they're easy, they're effortless, and again, I don't see any retractions. I'm going to palpate your posterior and anterior chest to see if you have any tenderness or discomfort anywhere. Let me know if you feel some tenderness, okay? Sorry for the cold hands.
That's fine.
Okay. I'm going to do it posteriorly. Any tenderness or discomfort anywhere?
No.
Wonderful. All right. On examination, there was no tenderness noted or palpated to the anterior posterior chest. I'm going to assess your chest for expansion. So what I'm going to do is just place my hands on your chest wall. I tell you what, let me get you to lie down for this.
Okay.
It'll be better done this way. And I want you to take out, I know my hands are cold, take a deep breath in and out. Good. Now I'm going to get you to sit up and we're going to do the same thing. Take a deep breath in. Out. Okay, chest expansion anteriorly and posteriorly is symmetrical. I'm going to also do another test called what we call tactile fremitus. And every time I put my hand on your chest, I just want you to say 99, okay?
Okay.
All right. You can say it out loud.
Oh, 99.
Sure. Okay, good.
99.
Good.
99.
Okay, wonderful. I'm going to do it posteriorly. Just say 99 out loud.
99.
Good.
99.
Okay.
99.
Good. Last time.
99.
Wonderful. Okay. Also, on your exam, I'm gonna go ahead and listen to your lungs, okay?
Okay.
Just to see if I hear anything that I shouldn't be hearing, okay?
Okay.
I'm gonna start posteriorly first, and then I'm gonna do it anteriorly.
Okay.
Okay. And each time you feel my stethoscope on your back, take a deep breath, okay?
Okay.
All right. Good. Good. Okay. Good. Again. Again. Good. Good. Okay. Again. All right, wonderful. I'm going to listen to your lungs anteriorly, or the front portion of your chest.
Okay.
All right, take a deep breath. Good. Wonderful. Okay, I'm getting up under here for me. And last time. Good. Wonderful. Mr. Travis, everything sounded good. His lungs are clear. There are no adventitious breath sounds. I didn't hear any crackles, any rails, any bronchi, any wheezing. I did hear bronchial sounds that was over the manubrium anteriorly. I also heard bronchiovesicular sounds that were at the first and second intercostal spaces anteriorly. Posteriorly, those sounds were heard in between the scapula. And the vesicular sounds anteriorly and posteriorly were heard throughout the lung fields, outside of the bronchial and the bronchiovesicular areas. Okay, what I'm going to do now, we're going to go to doing your cardiac exam. This should be a little easier for you. You can lift your gown for right now, but I'm not going to tie it because I'm going to have to listen to your heart again, okay? All right. All right, so I'm going to first start off by just inspecting and looking at your neck. And what I'm doing, I'm looking at your carotid arteries, okay, or your carotid pulsations. And, okay, his carotid pulsations are barely visible. Now I'm going to palpate, okay? Okay. His carotid pulse is brisk. And it's brisk bilaterally. Next, I'm going to actually inspect your jugular vein. So to inspect your jugular vein, Mr. Travis, I'm going to need you to lie down for me. And I'm going to sit up for a second. I'm going to put this bed down just a little bit more. Okay. The bed should be at about 30 degrees. I'm going to have you look over to the wall that way. His jugular pulsations are notable. Are noted on a visual inspection of on the right side. Mr. Travis, if you could look back towards me. Okay. And it is noted also on the left side. Okay, they're visible. Sit up for me. Okay. All right. I'm going to now at this point I'm going to auscultate your carotid arteries to see if there are any bruits. And I'm going to change the position on my stethoscope from the diaphragm to the bell. And I'm listening. Okay, no bruits noted. Hold your breath for me. Good. You can release. Breathe. No bruits noted on the exam of the carotid arteries. All right. I'm going to, now I do need you to lay down again.
Okay.
And I'm going to inspect your chest wall again. So if you can pull your gown down. And I'm going to assess for lifts, heaves, and thrills. Okay. Okay. Okay, there are no lifts, heaves, or thrills noted on examination. At this point, I'm going to listen to your different areas of your heart, okay?
Okay.
All right. And I'm going to start off by listening with the diaphragm of my stethoscope. Aortic, pulmonic, herbs, tricuspid, mitral. Okay. Now I'm going to listen with the bell of my stethoscope. Aortic, pulmonic, herbs, tricuspid, mitral. Okay. And in the aortic and pulmonic areas, S2 is greater than S1. Herbs, S1 and S2 are equal. And at the mitral and tricuspid area, S1 is greater than S2. All right. On his exam, his cardiac exam, I didn't hear any extra heart sounds, no S3s or S4s. I also did not hear any murmurs. Now, Mr. Travis, I'm going to go ahead, you can sit up, and I'm going to do what we call a peripheral vascular examination. And pretty much I'm going to start off by just looking at your skin all the way down to your fingertips, okay? All right. I'm also going to need to look at your toes as well. Is that okay with you? So when we get to that part, we just have to take the socks off.
Okay.
Okay, cool. All right. So I'm going to just look at your arms. And his skin color, again, is appropriate for ethnicity. There is no, his arms, there's no swelling, they're symmetrical. I don't see any signs of cyanosis to the arms. The temperature of the arms, you turn your arms this way, just relax. Okay. They're warm. His skin is dry, with appropriate moisture. There's no lesions. There's no his skin is intact. I'm going to also look at your nail beds, okay? Capillary refill is less than 3 seconds. Bilaterally, I don't see any yellowing of the nail beds, any clubbing of the nail beds, no cyanosis noted to the nail beds. I'm going to look, test your pulses. I'm assessing the radial pulses. And they are brisk bilaterally. I'm going to test your brachial pulse. And they are also brisk bilaterally. Let's see. I'm going to also assess the apical trochanter node, lymph node. And I don't feel any lymph nodes on exam of this area. Now, test the other one or assess the other as well. No lymph nodes palpable on exam. We're going to also now look at your legs. And again, I'm looking at the color. It's appropriate for ethnicity. No cyanosis, no yellowing noted to the skin. The skin temperature is warm. It is dry with appropriate moisture and is intact. I don't see any lesions. I don't see any edema. Again, no swelling noted or anything like that. I'm going to also look at hair distribution. His hair is evenly distributed on both legs. Coarse hair. There are no patching areas or slick areas noted to his legs. Now I need to see your toes, if you don't mind. Okay. Again, his feet, they are warm, dry, intact, no swelling. I'm going to test capillary refill of the toes. They're less than 3 seconds bilaterally. You can put your socks back. Well, you can leave them on because I got to test the pulses here. Okay. While I'm here, I'm going to go ahead and assess the dorsalis pedis pulse. It is 2+. The posterior tibial pulse on both sides bilaterally are 2+. Okay, now you can put your socks back on. Okay. I'm going to now assess for your popliteal pulse, so I'm going to pull this table out and have you lay back. And I want you to bend your knee. Okay, just kind of relax it some. Okay, I'm assessing for the popliteal pulse. It is brisk. All right, assess this one as well. It is brisk as well. All right, to continue to lie down, you can stretch your legs out. Okay, and if I were going to assess his femoral pulses, it would be here in this area, and I would expect those to be brisk and at 2+. And if I was going to assess for any inguinal lymph nodes, it would be a little higher up from the femoral pulses, and they should not be palpable. I'm done. I'm done, Lincoln. Okay. So we're done for this one.
No longer recording.
Okay.